Good morning, everyone. Thank you for joining us today. My name is Nicole Weidman, and I am the Director of Operations and Policy with the Retirement Office, which is part of the Office of State Treasurer. I wanted to welcome you here today for our third virtual session. As you know, there have been some changes that are going to be taking place to your health insurance. These changes will begin January 1st. And HealthSpring, who is joining us here today as our new partners, will be replacing your Vermont Advantage Blue as your new health provider. So before we get started and before I introduce these fine folks, I just wanted to do a few housekeeping details. So for those of you who may not be as familiar with virtual meetings, in the Teams format, which is what we are on today, at the top of your screen, there should be a few icons. Some of those icons will be a little button that says mic or looks like a microphone. That will be at the end of the presentation. If you need to ask a question, you would just hit that and that will unmute your microphone, and that will mean that we will be able to hear you. If at any time you would like to turn your camera on, there is a little camera button next to that, and you would just also hit that button as well. There is also a chat function, and that is also at the top of the screen, and it is probably more toward the left of the screen, and it is a little bubble, and underneath it, it should say chat. So if during the meeting, if you would like to ask any question, which we certainly encourage, you would want to hit that button and it'll pop up a text box and you can just type out your question. We will certainly be answering your questions as they come in. We do have one person answering all of those questions, so please be patient with us as we get to each of those questions. And at the end of the presentation, that is when we will be opening up where you can unmute your mic and we will engage in conversation. So I would like to introduce our new partners, HealthSpring. We have with us today, we have Shauna Rink and we have Jessica Moore, and they will be assisting us today with the virtual session and with our future virtual sessions and our upcoming in-person meetings. These meetings are designed to give us some insight into who is HealthSpring, what the new plan is going to look like, how it compares to your current plan and coverage, and what steps, if any, you need to take during this transition period. So this is an opportunity for you to hear directly from these folks, and you can ask questions, as I stated, and you can begin to prepare for what we hope to be a smooth and seamless transition. So with that, I would like to introduce you to Shauna Rink.
Very good. Thank you, Nicole. Good morning, everyone. On behalf of HealthSpring, we are honored to partner with Vermont State Teachers Retirement System. So thank you so much for joining us today. I'm Shauna Rink and Senior Advisor for our Group Retiree Solutions team. And we also have, again, Jessica Moore, who is the Senior Client Consultant, along with some other HealthSpring members on the phone with us today. Jessica will be providing you with an overview of the HealthSpring Medicare Advantage plans and everything that the plan has to offer. Then, as Nicole had mentioned, we will open it up for a Q&A, but please feel free to ask questions in the chat. We will be answering those along the way, and we will make sure that we get to all of your questions. So we look forward to sharing more with you about HealthSpring. And then we are committed to a seamless transition, personalized solutions, dedicated retiree support, and we are going to be with you every step of the way. So Jessica?
Thank you, Shauna. Good morning, everyone, and thank you so much for joining us. I'm going to go ahead, as Shauna and Nicole stated, we'll go through the presentation. And as I go along, we've got the chat available to answer your questions, and then we will do the Q&A at the end. So let's go ahead and get started and introduce you to HealthSpring and the benefits. So first, we'll just introduce ourselves, HealthSpring. So we serve over 4.8 million retirees for medical and prescription drug plan for Medicare retirees. We've been offering Medicare Advantage and group retiree plans for over 30 years. And we have been a Medicare Part D carrier for 19 years, which is how long Medicare Part D has been around. So since it was established. And some of you who have been in Medicare for a while may already know this, but we may have some retirees that are approaching age 65 or newly eligible. So just a little overview. Medicare is a federal health insurance program, mainly for people ages 65 and older, but there are sometimes exceptions due to certain medical conditions where someone may qualify for Medicare before they turn 65. The federal insurance program is to cover hospitalization, doctor visits, preventive care, skilled nursing facility stays, prescription drugs, and home health care. And there are some drugs that are designated medical expenses and some drugs that are designated pharmacy expenses. Here are the 4 parts or the ABCs of Medicare. So original Medicare refers to Part A and Part B. Part A is the hospital insurance and Part B is the medical insurance. Then Part C is what is used to identify Medicare Advantage plans. And Part D, the easiest to remember, is for prescription drug plans. Now, the Part C and Part D plans are only offered by private companies such as HealthSpring. Medicare does set the rules and the guidelines of the basic level of coverage that needs to be included. And so we do follow those, but they are administered solely by the insurance company. How does original Medicare compare to Medicare Advantage plans? So original Medicare, often, as noted, it has the Part A and the Part B, and then sometimes you will supplement with a Medicare supplement plan to expand the benefits and what's covered, and then the Part D, and they're all separate pieces. There's no extra benefits. So Medicare says this is what's covered, and that's it. Now with the Medicare Advantage plan, it puts everything all in one. So you see all the pieces form the puzzle. And so your medical coverage, your hospital coverage, your prescription drug coverage are all in one, plus there's extra benefits. So it includes things that are not covered by Medicare. And I will just note that for the 3 plans that are offered to you as retirees through VSTRS, there's 2 plans that include the prescription drug coverage, and then there's 1 plan that does not. So that one piece would take away for that 1 plan. And speaking of the plans, so they are a match of what you have today. And these are the 2 plans, just high level of what the benefits are for the comprehensive or comp MAPD plan, and then the JY MAPD plan. So you'll note here, the benefits are the same both in and out of network. So with these plans, you can go out of network and you're going to pay the same dollar amount out of pocket. So the annual deductible for the comp plan is $300. The plan out of pocket maximum is $600 that applies to in and out of network. For a doctor or a specialist office visit, it's a 20% coinsurance after the deductible. For inpatient medical hospital care, it's a 20% coinsurance after deductible. For emergency or urgent care, those are both 20% coinsurance. For diagnostic tests and lab services, for EKG and colorectal screening, it's a $0 copay, and all other tests and services are 20% coinsurance after deductible. And then preventive care is a $0 copay for your annual wellness exam and for all preventive services that are covered by original Medicare. For the JY MAPD plan, it's a $100 annual deductible, also a $600 plan out of pocket maximum that applies to in and out of network. For a doctor or specialist office visit, it's a $20 copay. For your inpatient medical hospital care, it's a $0 copay per admission. For emergency and urgent care, it's a $20 copay. For EKG and colorectal screening, it's a $0 copay, as are all other services and tests. And then preventive care is that $0 copay. And then we have, this plan is currently called the VSTRS 65. It's the same plan, just with a new name, and that's Advantage 65. And again, the benefits are the same in and out of network, but just a reminder that this plan does not include prescription drug coverage. So there is no annual deductible, no plan out-of-pocket maximum, and then it's a $0 copay for your doctor or specialist visit, for your inpatient medical hospital care. It's a $0 copay for emergency and urgent care, $0 copay for diagnostic tests and lab services, and for that annual wellness exam and preventive services. So we mentioned that benefits are the same in and out of network. The Medicare Advantage plans with HealthSpring give you access to care when and where you need it. The doctors do not have to be in our network. Your benefits are the same, regardless of whether the doctor is in network or out of network. No referrals are required, and primary care physicians are encouraged, but not required. We think it is great if you have a primary care physician because they serve as your personal guide through your health journey. They know your medical history. They can monitor all your tests, prescriptions, and preventive needs, and they can coordinate care with other providers or specialists. But again, it's not required. There's nationwide coverage and provider access. And you also, as an added benefit, have worldwide emergency coverage included in all three of the plan options. So with the freedom to choose your own providers, we mentioned again that you don't have to choose an in-network provider. You just need to, if you do go to an out-of-network provider, you just need to have a provider that accepts Medicare and accepts the HealthSpring Medicare Advantage PPO plan. And what that means is that they are willing to treat you and they're willing to bill HealthSpring. And in the event that your doctor says they will not accept the plan, please let us know, because we have a team that will outreach to the doctor on your behalf and they'll explain how the plan works. In most cases, this will resolve the issue. So oftentimes when a provider refuses to accept the plan, they aren't always familiar with Medicare Advantage, or there can be some hesitancy because a lot of out-of-network, or a lot of plans that have out-of-network benefits, it's a higher cost out-of-network. But once they hear that it's the same cost for you, that usually puts it to rest, and they'll usually take it. There are some doctors that will say no, but most of the time we're able to resolve it when our team reaches out to them. This is just a high-level view. This is by no means all-inclusive, but these are some of the frequently used provider groups and hospital systems in the greater Vermont area. And you'll see on here, some of the centers on here have single asterisks and some have a double asterisk. So the ones that have the single asterisks, we know that although they're not in network, they do accept the plan, and they have already been accepting HealthSpring members. The ones with two asterisks are hospitals that are in network with us. So we have a strong focus on your overall health and wellness. One of our core beliefs is the importance of preventive care. We always aim to try to either catch diseases before they occur or before they get worse if you've already been diagnosed with a disease, and we try to prevent it from getting worse. So we strongly encourage the yearly health checkup, all the recommended preventive screenings and vaccinations. We'll also do care reminders. We offer in-home checkups and screenings, and we also have incentive rewards for healthy activities. And we do our best throughout the year to help you stay on top of all of these things. So one of the times we mentioned was the incentives program. With our incentive program, you can earn up to $200 in incentives for completing healthy activities. And they're not just your visits and things. There's also other ways to earn incentives. So for those medical ways to earn, you can get incentives for going for your yearly health checkup, getting screening like a mammogram, managing diabetes with screenings, completing a colorectal screening, getting a routine vision or hearing exam. And there's also fitness and social and digital ways to earn incentives. So if you complete monthly fitness challenges by being active 3 days a week, there's some social events that will qualify when you connect with others. And then also connecting with HealthSpring by registering at myhealthspring.com. Now, things that you need to know about the program and how it works, you do need to opt into it. And you can do that either online or by mail. And you will, once you are enrolled in the plan, you'll receive information in the mail, and it'll include a form that you can fill out. It's a very simple form that you can fill in, and you can go online to opt into the program. And once you're in, then you'll automatically start getting the incentives as you complete the activities. You can complete the activities in any order. You don't have to do one before the other before you start earning. And you can confirm that you've completed activities online or by calling customer service. And as you earn the incentives, the rewards automatically get loaded to your HealthSpring Flex card. This is a Visa debit card. Now, you'll get the Visa debit card shortly after you're enrolled in the plan or shortly after your effective date. But obviously, it won't be loaded with the benefits or with the incentives until you start to earn them. And just to note that you do need to, any rewards that you earn during 2026, you'll need to use them up before the end of the year, because extra dollars that you haven't utilized do not carry over to the next plan year. They start over. We have a dedicated team to provide support for members with chronic and/or complex conditions. So our care managers are here to give you a helping hand. They help with complex care, chronic conditions, and just navigating the complex healthcare system when you have such a condition. The support is from a broad team of healthcare professionals, from nurses to dietitians, social workers, respiratory therapists, oncology care managers, behavioral professionals, transplant care managers. They will coordinate your care. So sometimes when you have a chronic or complex condition, there's multiple sources of care that you need. They'll help coordinate that. They'll review your medications and therapies. They'll help you create a care plan to help reach your health goals. So again, trying to keep your condition from getting worse. They also can provide assistance with obtaining medical equipment, developing a healthy eating plan. They can also help you find community resources. So whatever resources you might need to try and make things easier, or if you're just looking for education about your condition and how best to manage it, and they can provide all of that assistance. And the way generally they will reach out to you proactively, but if you need their assistance and you haven't heard from them yet, by all means, you can also reach out to them yourselves, and there will be information about the phone numbers to reach them. We also mentioned earlier that there are some alternatives to help you staying healthy. We have in-home checkups and screenings that are offered. These would be done by a nurse practitioner, and the in-home screenings are there to help diagnose conditions like diabetes and colorectal cancer, so you can get kits in the mail for some of those screenings. This is all available at no additional cost, and the results can be shared with your doctor. So if you have trouble getting to your doctor in person, this is a great option. We do partner with a number of vendors that will vary depending on your location and what your needs are, that offer the in-home wellness exams and screenings. And so we just like to give you a heads up that you may receive a letter or phone call from one of these vendors, and they will be branded with HealthSpring, but just want to know that they're not directly through HealthSpring. So don't be alarmed if you see a different name associated with these in-home screenings. And if you want information about the in-home checkups and how to set something up, you can always call our customer service number, and there will again be more information that you'll receive once you're enrolled. Speaking of information and access to it, we provide care and support anytime, day or night. So the online, before you enroll, so there's a difference in what you access before you're a retiree enrolled in the plan and once you're enrolled. So before you enroll, you can visit healthspring.com/group MA, and you can utilize that to find a provider or network pharmacy. You can view your drug lists that are associated with the 2 plans that have drug coverage, the comp plan and the JY plan. And it also will give you access to plan information in other forms. We also have telehealth virtual care with MD Live. So this enables you to speak with board certified doctors, either by phone or video. And this help is available 24 hours a day, 7 days a week for non-emergency conditions. And that's when you're unable to get to your doctor's office. So maybe you're not feeling well enough to travel to your doctor's office, or maybe you're visiting family somewhere and you're not close enough to home to see your doctor. This is a good option for you. And you can also utilize, once you're enrolled in the plan, our myhealthspring.com and the myhealthspring app, if you want to use your phone. And on there, you'll be able to see your personal account, to view your benefits, to find providers, download your member ID card. So you'll get an ID card in the mail, but if you lose it or left it at home or something, you can download that with the app. And you can also complete a health risk assessment online. We have added benefits and support that we've talked about. We talked about the HealthSpring Flex card, and that's, again, when you complete the healthy activities, you can earn incentive rewards, and it's going to come on a Visa debit card. The amounts will automatically be added once you've confirmed that you have completed the activities, and you can earn up to a total of $200, and that $200 or whatever you earn can be used to purchase pre-approved items online at healthspringflex.com and by phone and at participating retail stores. So there are some retail stores that do also participate. And if you go to healthspringflex.com, you can find a list of those that participate. Some of the other added benefits to support your health and wellness are vision services. So there are Medicare covered vision services, which are somewhat limited. This is for your routine eye exam. And with that, you have a $200 yearly allowance for your choice of eyewear. So the glasses, contacts. Also have hearing services. So this includes a hearing exam, a hearing aid fitting evaluation, and you have a $2,500 annual hearing aid allowance. And we also have a fitness program, and the Silver and Fit fitness program provides multiple options. You can get a gym membership with participating fitness centers nationwide, and you can change if you want to switch at any time. There's no requirement to stay with the initial one that you utilize. And if there is a gym that doesn't participate, you can always nominate them and suggest them to us, and we'll do an outreach to see if they're willing to participate in the program. In addition to gyms, you also have the option to utilize home-based fitness with different kits. There's a wearable fitness tracker. You can get a yoga kit for home, a strength kit. There's a variety of things. There's also access to a well-being coach, and they're available by phone, video to chat, and they can help you with any of your goals. So as simple as just walking, or if you want to do the strength training, they can help you with any of that. We also have home delivered meals. So this is for if you've had a hospital stay or skilled nursing facility stay that qualifies, you can get 14 meals delivered. Who doesn't like having someone else cook for you? And it's optional, so you'll be contacted automatically upon discharge to see if you'd like to participate. You can certainly decline, but that's 14 meals that you don't have to cook, and they will cater to any dietary restrictions you might have, any allergies, or even just preferences, like you don't like a certain thing, they'll take all that information down from you, and they'll build the meals based on those restrictions or preferences, and then they'll be delivered to you. And again, that's at no extra cost. And that is available for up to 3 hospital stays or skilled nursing stays that qualify per year. And then we also have, whoops, I just jumped ahead, sorry. We also have caregiver support. So this benefit includes consultative services to help with caregiving. And this is whether you're a caregiver for someone else, so maybe your spouse's caregiver, or if someone else is a caregiver for you, the resources are available to either scenario. And it's to help provide locating resources to make the caregiving easier, also to relieve stress, and also to help with any health-related social needs. They can help with all of that. And it's just to ensure you and your family have the knowledge, recommendations, and support that you need. There's also access to an online application to stay in touch with your caregiver coach, share information with others in the caregiver team, and access the support and resources. Here we have an overview of the prescription drug benefits, and these are Part D benefits that are built into the comp and the JY65 plan. So just again, a reminder that the Advantage 65 plan, which is currently called the VSTRS 65 plan, that does not have prescription drug coverage. So for those that do, the deductible phase is a $0 deductible, and then you pay copays. For generic drugs, it's $5. For preferred brand drugs, it's $20. And then for non-preferred drugs and specialty drugs, it's $45. So it's the same copay for both those categories. And you have a max out-of-pocket of $600 for your plan. And then once you reach that max out-of-pocket, you'll pay $0 copay for all of your drugs. This is side by side to show some of the benefits of getting home delivery. So, and again, the benefits are the same for both plans. So at retail, for a 30-day supply, you see you'll pay $5. If you get a 90-day supply through home delivery, you'll pay just 2 times that amount instead of 3 times. So while you can get a 90-day supply at retail in a brick and mortar pharmacy, you would pay 3 times. And so you do save by just paying 2 times when you go for home delivery. So for generic drug, again, it'd be $5 for a 30-day supply at retail, only $10 for 90-day supply home delivery. For preferred brand, it'd be $20 for that 30-day supply versus $40 for a 90-day supply at home delivery. And then for the non-preferred and the specialty drugs, it's $45 for that 30-day retail. For the non-preferred, you would pay $90 for home delivery. And then for specialty drugs, these are not available for more than a 30-day supply. So you can get them through home delivery, but you can only get up to a 30-day supply. And again, you have that $600 out-of-pocket max.
Is it working, Phil?
So we have the Medicare Advantage drug list tiers. So you saw we had 4 levels of copays, but really it's 3 like you have today. It's just that Tier 3 and Tier 4 have the same dollar amount. So Tier 1 is the preferred generic drugs. Tier 2 is the preferred brand drugs. Tier 3 is non-preferred generic and brand drugs. And then Tier 4 is specialty generic and brand drugs. Our Medicare Advantage drug list includes coverage for most of the drugs that people in Medicare plans commonly use. Medicare sets the baseline of all the classes of drugs that need to be included, and then we build up from that. And again, it is on the Medicare and what's commonly used. So in your formulary drug list, when you go to look at it, you'll see the drugs with the tier designation. Just again, a reminder that Tier 3 and Tier 4, maybe you see Tier 4, it's the same exact copay. So they're both $45. When you're transitioning to the new plan, the formulary may be a little different than what you have today. just in the tiers or the requirements, or sometimes regardless, you're starting with a new carrier, so we have to have like the prior authorizations in place if they apply. So what we can do, if you have a drug that either isn't on the formulary, or perhaps you have already gone through the step therapy and you and your provider don't want you to have to go through that again, or sometimes it can take a little bit of time for prior authorization. All those scenarios, you can get a one-time transitional fill so that there's no delay, you don't miss having the medications. So while you're either working with your doctor to find an alternative if it's not on the formulary, or doctor's working to get you approval for whatever you're taking, cover up to the 1 month supply. And this is in the first 90 days you're in the plan. So if you start January 1st, 90 days from there, you have access to this one-time fill. If you have a product that falls into this category, this will apply to any of the prescriptions that might fall into that category where you need to either find an alternative or have your provider request the exception. If you have 2, you have 3, you can get that one-time fill for all of them. So you mentioned prior authorizations. Some services or medications may need a prior authorization. This is just an approval that your doctor must get from HealthSpring before you receive specific services, procedures, medications, and medical equipment. They're there just to ensure that you receive care from doctors who share our commitment to quality care. They also help make sure you're taking the right medications for the right conditions, and they can help make it clear what's covered on the plan. We talked about the home delivery option. So this gives you obviously the convenience of having it delivered and some savings. Our home delivery plan, you can order, manage, and track your medications on your phone or online. You get standard shipping at no extra cost, and you can fill up to a 90-day supply at one time. You can sign up for automatic refills, or you can get refill reminders so that you don't miss a dose. You also have access to pharmacists who are available 24/7 to help with any questions you might have, any concerns about side effects or interactions between different prescriptions. They can help with anything that you have a question about. And then we do have flexible payment options for that. You are not required to use home delivery. So this is just another option that you have if you don't want to utilize home delivery. Or we did hear in a prior meeting that some folks have difficulty with getting their mail or getting it timely. So this is, again, not a requirement. We just want you to know that it's another option that's available to you. And when our home delivery is through Express Scripts Pharmacy, to get started, you can call and you can walk through what, if you have your medication list ready, you can call to get set up. And again, they're available 24 hours a day, 365 days a year. You can also go online to set up your profile at myhealthspring.com. So either by phone or online. Here's what you can expect after you enroll. So let me just first preface that with, before you enroll, you're going to receive some materials. You've probably already received a letter from VSTRS, and you'll be receiving a pre-enrollment package from us. And this will include information about the benefits for the plan you're currently enrolled in. It'll have information as to where to access your benefits, to look at them online. It'll have a formulary addendum, and it will show you where to go look at your formulary. So that will come in the next month or so, these various mailings. But once you're enrolled into the plan, then you're going to receive a welcome kit that will have more details about all these extra benefits we talked about and other information and all the resources available online and by phone. You're going to receive an ID card, which will come separately from the welcome kit. And this is a sample of what it looks like. And just to note, for those in the Advantage 65 plan, your ID card will look very similar. Just some of the drug information won't be on there, but you will still see some of the, like the RX bin, RX PCN, you'll still see that information in your card, because as noted before, some drugs are covered by Part B medical. So you'd use this for that. But just keep in mind that that Advantage plan doesn't have prescription drug coverage. And then we also talked about the HealthSpring Flex card. So this is that Visa debit card that your incentives will be applied to as you earn them and as you complete the qualifying events. And this is just a sample of what that will look like. Also after you enroll, so you'll receive some things in the mail, and then if you have hopefully provided your phone number and maybe your email to visitors, they will in turn pass that on to us. If we have that information in our system, you're going to receive a welcome call for your new plan, and they will make 3 attempts to reach you. And this is just to answer any questions that you may have. They'll review your plan benefits and the features and the resources and where to find them. And they can also help you find a doctor or pharmacy. And again, if you have a doctor that is not in network and you need them to reach out to them, you can give them that information and they will get that to the team that outreaches providers. And you'll also, again, if we have your email, you'll receive a series of 3 welcome emails to help you make the most of your plan. It'll give you a preview of what to expect in the mail. It'll provide quick links, so you'll be able to just click on the links in the email to access some of the important online tools and resources that we've talked about. And then the emails will also include tips and available resources just to help you take care of your health. And this is very similar and some of the same resources that we mentioned for the medical portion. So you can go to healthspring.com/group MA or PDP to access your pharmacy, your drug list. And then after you enroll, so that's before you enroll, once you're in the system, you can use the myhealthspring.com and the MyHealthSpring app. And then again, we have Express Pharmacy to answer your questions for home delivery. Critical coverage and late enrollment penalties. So Medicare, again, sets the guidelines for all these plans. So Medicare requires that everyone is either in a Medicare Part D plan or a prescription drug plan that has creditable coverage. And what that means is that the coverage is at least as good as, if not better, it has to be as good as or better than Medicare standard Part D plan coverage. So Medicare will say, okay, this is the basic level of coverage. It should be at least as good as this and can't be less, or otherwise if it's not as good, it's not considered credible coverage. So again, that requirement is that you either have a Part D plan or a plan with credible coverage. So it is strongly recommended that even if you don't use prescription drugs today, that you do enroll in a plan that has either the Part D associated with it, or if you perhaps have another plan that has credible coverage. Now, if you don't meet the requirements, then once you do enroll in a Part D plan, Medicare is going to assess a late enrollment penalty. And that's specifically for anyone who does not enroll in a Part D plan or credible coverage for a period of greater than 63 days after becoming initially eligible for coverage. So if you just turned 65 and you go longer than 63 days to enroll, then once you do enroll, you'll get that penalty. Or if you have a plan and you drop it and you go greater than 63 days before you have another one, then they assess that penalty. And that late enrollment penalty does not go away. It's not a one-time thing. It's just a monthly fee that you'll incur. So now we just want to cover some additional important information. So some may qualify for extra help with prescription drug costs. And this extra help can be in the form of reduction to the premium that you pay, and or sometimes it's even a reduction in the copays that you pay at the pharmacy. Most of the time, Medicare will notify you if you qualify for low-income subsidy, but you can certainly reach out to see if you have not heard anything and you think you might qualify, or maybe there's been a recent change in your circumstances that you think now you'll qualify. There's a few different resources to check and apply. So you can contact Medicare at 1-800-MEDICARE. You can call the Social Security Administration, or your state Medicaid office. And if you live in Vermont, that number is the 1-800-250-8427. On the flip side of extra help is IRMA, or income related monthly adjustment amount. So some people may have to pay an extra dollar amount to the Social Security Administration because of their yearly income. And these amounts do change typically annually. For 2026, currently the amounts that are posted by Medicare is if your income is $97,000 or above for an individual or married individuals that file separately, or $194,000 or above for married couples, then you may pay an extra amount for your Medicare Part B and Part D coverage. What happens if you're impacted? So this is not something that we can determine or be involved with. You would hear directly from Social Security Administration, and they'll send you a letter telling you what the amount is and how to pay it. And so this is, again, a fee separate from your premium for the Medicare Advantage plan. It's separate from your Part B premium. It's an extra fee. And the only time that we are notified that someone qualifies for IRMA is if they don't pay it. Medicare will contact us and tell us that we have to disenroll you from the plan due to non-payment for IRMA. Now, they do reinstatements, but again, you would have to do that through Social Security Administration. So if someone misses a payment because they were traveling or whatever the situation, they can appeal. And then again, it's on the Social Security Administration to reinstate you. If that does happen, they'll let us know that you can be reactivated on the plan. Eligibility enrollment, frequently asked questions. When am I eligible to enroll in one of the Visitors Plan options? So these plans, the change to HealthSpring is effective January 1st. If you are, whatever plan you're in today, you're going to be automatically enrolled in the new plan. So you don't need to do anything. So I'm jumping ahead and answering that. How do I enroll? So if you're already in one of the plan options and you don't want to make any changes, you're going to be automatically moved to the new plan, again, with a January 1st effective date. If you do want to make a change, then you would contact Visitors to let them know what plan you want to change to. Or if you are just newly turning 65, if January 1st is the first month you're going to be eligible, then again, you would contact Visitors so that they could put you on the file and send you to us. Do I need to be enrolled in Medicare Part A and B to qualify for the Visitors Plan options? Yes. So Medicare does require that if you are enrolled in a Medicare Part C or Medicare Advantage plan, you are still required to be enrolled in Medicare Part A and B. Can my spouse or dependents get coverage if they're under age 65? Yes, they can. They would be enrolled in whatever options Visitors has for pre-65 enrollees. Can I enroll in more than one Medicare Part C plan? No, you cannot. And again, that is a CMS or Medicare rule. And once you are enrolled in one plan, if you enroll in another, it's going to automatically disenroll you because Medicare monitors all enrollments for Medicare Advantage plans. And so if you enrolled in a new one, it would automatically disenroll you from your current plan. Can I enroll in the Advantage 65 MAPPO plan as well as a Part D prescription plan? No, you cannot. So again, this is a CMS rule that if you're in a group Medicare Advantage plan, you are not eligible to enroll in a individual Part D plan. So very important to keep that in mind if you're enrolled in a plan about the prescription drug coverage. And then I already mentioned, how do I enroll? You don't have to do anything unless you're making a change, in which case you would contact Visitors. Just a recap of the benefits of HealthSpring Medicare Advantage PPO. You have that freedom of choice to utilize in or out of network doctors as long as they participate in Medicare and accept your plan. You can go to them if they're out of network. And again, there's no referrals required. And while we encourage you to pick a PCP, you don't have to. We have a strong focus on health and wellness. And that includes some of those extra benefits like earning incentives. For the comp and the GY 65 plans, you have the integrated Medicare Part D coverage. So it's medical and pharmacy all in one. And we have all the added benefits like vision, the hearing, the extra meals, the silver and fit. And then we have lots of resources for information and support to try and help you navigate your plan and whatever healthcare you need. And we have our customer service team that is dedicated to just our seniors and our Medicare Advantage plans, and they can help you with your medical and prescription drug questions. And they cannot help you with premium questions. So that's something you have to go directly to VSTRS for, but they can help you with questions specific to your plans. And we had late breaking news right before, so I did not have a chance to update this presentation, but wanted to let you know that the number is live today. So the phone number will be the same both before you're enrolled in the plan and then once you're enrolled. And this phone number will be in the communications that you receive, and it will be on your ID card. And I will be updating the presentation for future meetings, but for today, I can let you know it's 1-888-281-7867. And I think we can put that in the chat as well. They're available 7 days a week from October 1st to March 31st. And then Monday through Friday, April 1st through September 30th. And that's 8 to 8 local time. So accommodating for different time zones, wherever you are, they're available till 8 p.m. And then I want to know, if you call now before you're enrolled in the plan, when you call, it will ask for an ID number. You obviously don't have one yet, so you can bypass that when you call them. And if you have specific benefit questions, then you should let them know what plan you're in today. So assuming if you're in the comp plan today, and if you're going to stay in the comp plan, just let them know which set of benefits to look at helping you. And you won't, obviously right now, because you're not enrolled with us yet, they can't see, they don't have access to know which plan you're in today. And then if you have questions about the other plans too, you can also ask that. And again, they can start with making requests to outreach doctors. You don't have to wait till you're enrolled for us to outreach providers to confirm that they'll accept the plan if they're not in network, or if you want them to help you determine if someone is in network, they can help with that as well. And then we also have support for chronic conditions. We mentioned this, where you can speak to a care manager. And again, we'll get that number posted as well. They're available 8 to 5, Monday through Friday. And that's 8 to 5 Central Time. And we just want to give you a review of the claims process on the Medicare Advantage plan. So step 1, you visit your in-network or out-of-network doctor or hospital facility. You'll show your HealthSpring ID card. You do not need to, and you should not show your Medicare red, white, and blue card. Keep that in a safe place at home. You still need to have that, but you don't need to show that for services. And then you'll pay your copay or coinsurance, depending on what the service is and what applies for your benefits. And then your doctor will send the claim to HealthSpring. And then once it's processed, we'll send you an explanation of benefits, or EOB, as your receipt and documentation. And you will also be able to see that online. In the event that you have to submit a claim yourself, this will be under rare circumstances, but one example would be if you are outside of the country and you receive worldwide emergency coverage or services, then you would need to keep all your receipts, and you can submit a DMR or a direct member reimbursement claim form. And these are available online at healthspring.com/groupma. You would need to submit a separate form for each request. You attach all the payment receipts. If you don't have a detailed receipt for each claim service, call your doctor or provider for a replacement, because they will need to have those specifics. And then the receipt must show proof of payment and/or show signature from the provider. Make sure to make a copy for your records, and then mail one of those copies to HealthSpring at PO Box 1004, Nashville, Tennessee 37202. And that is the end of the presentation. Thank you very much for listening. And now hopefully you've been asking and getting answers to your questions in the chat. And we can also at this time open up, and as Nicole directed at the beginning, you can get to your microphone to unmute yourself at the top banner of your screen, and we can take your questions.
Thank you, Jessica. So yes, there have been questions in the chat, and we have been answering them along the way. I would like to recap some of those, but I do see a few hands that are raised. And I know that the Chris has actually had his hand raised during the presentation. So Chris, if you would like to ask your question now, we would be happy to answer your question. And Chris, you can find your mute button on the right hand of the screen, and there's a little mic button. And as long as it does not have an dash through it, that means we can hear you. And Chris, in the event that you cannot get your
All right.